hired to help people in need of mental health care. But what if that job is putting their health at risk? Tonight, investigator Mahsa Saeidi exposes violent incidents at state-run psychiatric hospitals in New York and finds out what's being done to protect both patients and staff.
And the morning of this attack on my husband spent 30 minutes talking him down, and they gave him an injection. He came out of his room and sucker punched my husband in the side of the face. From what I was told, my husband clinched like this and went straight back and cracked his head.
When he went to work that day, did you ever think something like this could happen?
Never.
Registered nurse Peter Schiffman had worked at the state-run psychiatric center on Staten Island since 1999. Last September, he was punched by a patient and placed in a medically induced coma. The patient was arrested for felony assault. State records show he had a prior conviction for attempted sexual abuse. Because of that, Schiffman's wife Erin says he was high risk and he should have been placed in a secure care unit for violent individuals, not a standard inpatient facility.
Who do you blame?
I blame the state, because that patient should have never been there. You can't let criminals into a hospital with people in the general population.
He almost died.
He almost died.
I remember nothing from my assault or ever meeting the person who supposedly hit me. The ICU staff held it as a miracle.
Did he end your career?
Yes. The pain now is something I have never imagined in my life.
Without warning, you were slashed in the face.
That's correct.
Nurse practitioner Carl Ankra attacked at a different state-run psychiatric center in Rockland County in 2019. The patient, later arrested and convicted, allegedly smuggled a razor and turned it into a weapon.
So he went right there from the corner of my eye all the way through my left eye. If he had gone a little bit deeper, I would not be here today.
The Office of Mental Health oversees New York's 24 psychiatric centers, of which 4 are so-called forensic facilities for individuals in custody. An OMH spokesman says the agency has a zero-tolerance policy towards violence. Quote, "We are constantly evaluating our practices, utilizing the best available approaches to improve safety, something that is reflected in the small number of assaults on staff at facilities." Since 2020, the state's recorded 57 assaults. That's roughly 10 a year. But the head of the nurses union, Wayne Spence, says it's much more common.
How often are these incidents happening?
I say on average about 2 a week.
2 a week?
Yep, across the state.
Spence, relying on data from a state system used to log potential workers' comp claims. Last year, hundreds reporting workplace violence, which includes assaults, threats, and aggressive behavior. Spence is now calling for better intake screenings, immediate removal of violent patients, and additional forensic-like secure care units.
The gentleman who assaulted Peter Schiffman, he fought with the parole officers. He was violent with them, but no one looked at his background. Every mental health facility used to have a forensic unit. The model that we're asking for used to exist.
For me, I work just to get through each day. It is hard. It's startlingly difficult.
Schiffman is now living with a traumatic brain injury, which makes it tough to even walk. Back at his old job, the patient's missing him, sending him get-well notes. And the wake of the attack, OMH made major policy changes at Schiffman's old workplace. Now, the family wants the policies to be implemented statewide.
Do you know that when that patient that assaulted my husband was taken off the unit, the patients clapped for him to be gone because they were petrified for their lives? They were cowering in their rooms, afraid. They clapped.
And again, the state tells me that policies have been revised on Staten Island. They have retrained staff on risk assessment. They've established a critical response unit, and they're running monthly drills. So, KJ, it seems like things really are on the right track. Like the family, the union wants these changes statewide.
Yeah, it certainly sounds as though, and those two obviously dedicated workers there that are still dealing with the ramifications of their experiences today, it sounds as though that these workers really do want more secure units for these patients that are potentially dangerous. Is the state willing to do that?
Yes, right now, but just on Staten Island again. So that's where the most serious incident happened. But a secure care unit is for violent individuals not in custody. If you're in custody, you have the forensic units. I just want to note Carl that you saw. He's still working as a psychiatric nurse at the same facility, but now he's an outpatient, so he feels safer, because it's very traumatic.
Absolutely. You don't live, I mean, that's something that sticks with you the rest of your life. Mahsa, thank you for bringing that subject to us. If you have a story for Mahsa and our investigative team to look into, scan the QR code on your screen. Many of your tips often end up on our air.